So, hello everyone. I'm Ilay Madens, a laser enthusiast. Hopefully, I will give you a nice summary of what is achievable, what's new with lasers, and how they're different than, let's say, conventional approaches and conventional treatments. So, just a peek. One question, very quick question. Any idea what this is in the photo? Yes? PC, close but not correct. PC, what's that? Hard drive, yes, that is hard drive. Any idea about the capacity? 1 gigabyte, yeah. Any other ideas? It's 5 megabytes, yeah, and it's 5 megabytes. That means one photo with your smartphone today would fill all this up. And I can't call this mobile, but still they're carrying it away. This is the first hard disk ever being carried to the computer room, which is filled with the computer itself. So things have moved along, and definitely dentistry is not left behind in that. So just a few spots from history of dentistry. This is one of the earliest bridges that we know existed. This is one of the first implants. That's a wood actually found within the mandibular jaw there, and some of the earlier implant designs. Unfortunately, even though I call this Stone Age dentistry, it's not historic, still quite current. That's a bit sad. So that's why we are working hard to change the face of dentistry. Again, these are some of the tools. I don't know if any of you actually use these. So this is actually from, let's see. So this one is from my father's friend's office. He actually used this in his practice at the time. And this is from a museum in Istanbul, Turkey. And this is how things looked like back in the day. Any idea who this guy is? J.V. Black, yeah. So I would strongly believe he would still use a hard tissue laser today, classifying cavities and stuff. One misconception with lasers, that they are not possible to be used on hard tissues. That is wrong. And the second misconception, even if they would be used on hard tissues, they would be slow. So here you can see a 20 watts hard tissue laser, erbium YAG laser, cutting into a root of a dried wisdom tooth and cutting through healthy enamel, healthy dentine, almost going to the pulp in 10 seconds, and cutting through the roots, well, 2 roots in 20 seconds. Now the speed is there for these lasers, but it's not the biggest advantage. If you look here on the surface, there is no carbonization, there is no thermal side effect, there is no melting, but there is disinfection, and in some cases there is also stimulation for healing, and there will be open dentinal tubules, free of smear layer, free of bacteria. So these are the good things that we want to make use of, and these are the advantages of using lasers. Now, oops. This is my family when I can see them. This is me looking after the patient. This is me lecturing. This is me doing live courses. And this is me with some hair at the time and showing that I do get tired once in a while. But the laser is a big part of my professional and also general life. I've done my master's in Aachen University, my PhD in periodontology in Istanbul. And since 2016, I've been working in UK private practice. And again, every day for each of my patients, I use my lasers. So this is the setup with the photoner machine with the double wavelength option. We have hard tissue and soft tissue in it. And we also have a bunch of other lasers that we use for our patients. We have about 6 different wavelengths. So what is the difference also between these lasers? We will come to that. My latest passion is also life coaching and health coaching and business development through marketing. And I represent a lot of educational and training entities, and I train around the world around lasers and implantology and periodontology. And I review loads and loads of scientific papers for these journals. So this is where I come from, and this is how I am able to share my experiences. Now, one big thing is, why should we use lasers? There are a few aspects on that. One is, unfortunately, the perception of dentistry is not the best for the patients. And we are working hard to change that. When you talk about lasers, any lasers, even them not knowing what it's going to be used for, every patient will be interested in that. At least to learn more about it and see how we can help more our patients. Okay, I'll stay here. I think my presenter is not working the best. The second thing is better treatment experience for the patient. That is because for minor surgeries, for cavity preparations, and for many other indications, we can do the treatment without any injection or anesthetics. So that is a big experience. For some surgical treatments, we can do this without any bleeding, without any stitches. For cavity preparation, again, in addition to not having injections, we don't actually apply any pressure or vibration. I don't know if you had the slow handpiece used on you for any cavity preparation. That is not the greatest experience. The same goes for the curette for periodontal treatments. We can use the laser to clean the root surfaces instead of curettes. Also for wisdom tooth extraction, apical resections, or cyst removals, when we use the surgical drills on the bone. Again, we have the pressure, we have the vibration, which we don't have with the laser, still removing the bone as fast as the conventional tools, without the heat that the drills create, without the smear layer that they leave behind, which causes the inflammation afterwards, and with a better and quicker healing time after the surgery. What does it mean if the patient is having a better experience during the treatment? Obviously, the practitioner can have a better experience of the treatment instead of dealing with an anxious patient that is anxious about the bleeding, that's anxious about the pressure, that's anxious about the pain. We can actually focus on our work. Then, as I mentioned, because of the advantages of the laser, especially the erbium-YAG laser, that it's not traumatizing the tissue, then you have less complications afterwards after the treatments. It means less inflammation, that means less swelling and less pain. Obviously, because of the same reason, again, we have faster healing. But the most important reason I would use my laser, especially around periodontology, for example, is to have a better treatment results. The last thing, but not the least, is obviously the marketing. Especially in the UK, you would still be probably considered as an early adopter, especially investing in a hard tissue laser. That's very different now in Europe, US, Canada, Australia, because I also teach there. It's not at an early adopter mode, it's now more common. But still in the UK, you can still have the fruits of investing in a marketing sense. Now, marketing is good for the business, but I still feel it's ethically needed to market lasers, especially for patients to hear about it and to be intrigued to come in and to see you to receive more treatments. So that will help us help them more. If they are losing teeth because of periodontal disease, if they're intrigued to come in to see what the laser is about, we can help them maybe a bit earlier and save more teeth. So that's why I think marketing is a strong and important bit, which helps both the patient and the business. Okay, so what can we do? So that's a quick overview. We'll go into details a bit after this. So this is one video that the company has put together. I'll show you my cases afterwards. So we can use this in cavity preparations, endodontics, periodontics, surgical treatments, aesthetic treatments, both with the teeth and the face. This is removal of composite, and with the laser you can remove the composite and or enamel, dentin, cement or bone. All hard tissue, including porcelain, veneers, brackets, crowns, can be removed by the laser. Different applications for porcelain, but still we can remove it. Focus on your left, how fast it is. The right one is another technology, it's better now. So I should remove that. That's an older technology, but still nothing as fast as the Erbiumyak that I use. Sorry, I missed that. Let me go back. Very quickly. Now for endodontics, we can have the two different lasers to do different things. One of them will be to have a deep penetration into the dentine, actually, to kill the bacteria that's within the dentinal tubules. The other laser will go and have a cavitation effect and photoacoustic shock waves, which actually push the hypochlorite into the isthmuses, lateral canals, and the dentinal tubules to have a better cleaning in return for better filling of the root canals, which I will show you examples of later on. For periodontology, as I mentioned, we can use it to clean the root surface, to deepitalize, to disinfect the pockets, to create a clot, to remove the toxins from the root surface, which have an effect on the reattachment capacity of fibroblasts and blood cells. And we can also biostimulate the tissue to have a better healing. And here, why better healing, I mean better attachment. You can use it for surgical treatment. One example is here a specific type of hemangioma, and this soft tissue laser bit and the light walker will be absorbed in hemoglobin, shrinking the hemangioma immediately, and we can use it on the hemangioma, more conventional hemangiomas on the lips, on the tongue, and so forth. Gingivectomies, very easy, blood-free, and you can also do this injection-free, just with a topical anesthetics. For apical resection, which went by very quickly, we can use it for incision, bone removal, cutting the root apex, degranulation, deep disinfection, and clotting, all with the laser without using any conventional tools actually. We can use it to activate the bleaching gel. We can have the laser for facial aesthetics. If you're trained in doing external dermal treatments, you can do peeling, three different levels. You can do wrinkle treatments, you can do rejuvenation, you can do also even more surgical treatments, facial surgical treatments with the laser. We use, so that's another hemangioma, as I mentioned before, and many more indications. And we will go through a little bit more with clinical applications. Another overview video here. Again, this is how we use the photoacoustic shock waves for endodontics. You can see the bubbles and the vibration within the liquid, that's hypochlorite, which is being pushed and activated by the laser into the hard to reach areas to empty those spaces to be filled later on. Pulp capping, you can use the laser to disinfect and coagulate at the same time, increasing your success rates with direct and indirect pulp capping with different applications. Crown preparation is not a common routine use of the laser. It's a bit difficult to really arrange the walls and the parallelity. But if you're doing a single crown for a patient who doesn't want injections, you could use the laser to save the day. Again, for perio, as you can see, we open up the space a little bit, remove the diseased tissue, use the Erbiumyak to clean the root surface, and use the Nd:YAG for disinfection and coagulation. Gingivectomy and gingivoplasty, you can use the laser. Crown lengthening with Erbiumyak, removing the bone, osteotomy, without raising the flap. Having your biological width made appear with the laser without needing to raise the flap, which makes it much more predictable. Obviously, any lumps and bumps you can remove with the laser. With full safety for histopathology, there is no issue, especially with the Erbiumyak, because there is no thermal side effect on the tissue. so you can have your pathology report safely. Peri-implantitis, a big topic I also lecture quite often about. We can use the laser to remove the granulation tissue, to safely and effectively clean the biofilm on the implant surface, decorticate to create some bleeding to prepare the area for bone grafts, and use the Nd:YAG laser, the second soft tissue type laser, for deep disinfection and biomodulation. So we have multiple steps to prepare the surgical area for best regeneration after treating. So after removing granulation tissue, implant surface, we disinfect the bone and biostimulate. Biostimulation is where we have the laser energy absorbed by the mitochondria within the cells, which creates and provides the ATP, adenosine triphosphate, which is the energy currency of the cell. The laser, we provide more energy for mitochondria to produce more ATP to do what it needs to do. Caries removal, you can go really fast, as I showed you in the beginning, or you can go very slow, very selective, not removing any healthy tissue, just removing caries. Porcelain brackets, veneers, you can remove. Again, you have the option to go a bit quicker, but the veneer might break, or you can go a bit slower and actually save the veneer for temporization, for example, if you're changing your veneers. So it will just depend on the settings and then the time it takes to remove them. But anyhow, it's less than a minute. Snoring treatment is where we use the laser to tighten the tissues, starting from soft palates to larynx, more posterior area, and the muscles around the posterior area. That's non-surgical without any side effects, just shrinking the tissues to open up the airways. And that's why I started with sleep dentistry, just because I had this machine. I thought it would be interesting, and I got deeper and deeper into the topic. And it's, I think, quite life-changing when people can actually sleep, can go back into their bed with their partner instead of sleeping in a different room, and how they wake up, their mood, their energy. So that's a very, very handy tool to use for those cases where we use the laser. Again, non-surgically, no side effects. It's just 3 sessions where we can have the clinical effect. So we can do tissue removal, hard tissues, soft tissues, disinfection, deep disinfection, superficial, and these herpes treatments, reducing recurrence of the herpes, especially if the patient has quite often those lesions. We can definitely reduce it so that it doesn't happen again. Hemangioma, facial aesthetics, troughing, porcelain removal, bleaching, snoring treatment, and biomodulation as on top for any kind of pain and healing that we want. Again, we can use this on all areas of dentistry. There is no patient that we don't use the laser on in our practice. And it's not just me, all the dentists working in the practice. Can we do everything with the laser? No, there are some quite demanding patients where we will need to use other tools. So polishing we can't do with the laser. So as I mentioned, a few different lasers, erbium lasers, hard tissue lasers, hard and soft tissue lasers, and there are diodes and Nd:YAGs, which are near-infrared soft tissue lasers. So the difference between them is where they are absorbed. So this is running out of battery. So here you can see the diodes and Nd:YAG. They would be the soft tissue lasers. They are absorbed, as you can see in these lines, in melanin and hemoglobin. That means absorption would mean being absorbed and the energy being changed from optical light energy to heat. So that's when you wear a black shirt under the sun and you feel more warmth. That's because the optical energy coming from the sun is absorbed in black, and then it's turned into thermal energy, you feel the heat. That's the exact same thing between the laser and the hemoglobin and melanin. But because hemoglobin and melanin are within the tissue, these lasers will heat up the tissue. That's where you need anesthesia. But because it's absorbed and creating heat, they will not create any bleeding. So you can have a very clean surgical area with no bleeding, even with patients using anticoagulants. The other good thing with these is if you lower the energy, they will penetrate more. And that penetration will lead to absorption in the what I was just mitochondria. Yeah, and the mitochondria will then absorb this because of the darker color on it, and we'll use it for ATP. Or you can change this setting so that you have direct coagulation on a bleeding spot. So with different settings, you can have very low energy for biomodulation and healing. You increase it a little bit more for coagulation. You increase it a little bit more for vaporization of the tissue. That's a surgical use. Then that's one type. Near infrared lasers, which include the diode lasers and Nd:YAG lasers. I'm not going to be quizzing you on this, but just a small introduction on the physics side. Then the second part is the erbium laser, and the highest powerful one would be erbium YAG because of its high absorption in the water. What it leads to is the water will absorb the laser so strongly that it will evaporate very strongly, very quickly in microseconds. And what happens to water when it vaporizes? It expands, yeah? So if something is expanding very quickly, very strongly, that's an explosion. So we have two options with that. We have the water spray on the erbium YAG laser. Maybe you realize there was some water spray. Now this is different than the water spray we have for our fast handpieces. What's the fast handpiece water there for? It's for cooling, yeah? It's cooling down what's heated up because of the friction of the drill. Whereas with the laser, the water is there to stop the laser to reach the tissue, but then to explode to get the tissue removal. So that's why we can have injection-free surgeries or cavity preparations, because the laser doesn't necessarily reach the tissue to heat it up. Then it's cold surgery, cold removal of the tissue. Then the laser is there for the ablation. It's called water-mediated photomechanical ablation. But it's not there to cool it down after it's heated up. That makes a big difference in the inflammation for surgical applications and the pain during the cavity preparations and so forth. So that's where the erbium YAG is. And then obviously the difference between different erbium YAGs will be the technology delivering the energy and the amount of energy it can deliver. And then you can do your research in, it's like buying a computer. It's all about numbers. It's easy to compare between brands. So that will be the erbium laser, which can be used on hard tissues with the water spray and on the soft tissues also, because there is the water spray, or you can turn it off and use the water within the tissue. That will reduce the bleeding and so forth. So if you want minimum heat, minimum pain, but some bleeding is accepted, like surgical applications, you use it with water spray. If you want minimum bleeding, you turn off the water and use it on soft tissues. So that's what I mentioned. With very low powers, long application time, you get biomodulation, biochemical interaction, and then you go into thermal interactions with vaporization and ablation. So it's just a match between the time of application and the energy we put into the machine. So a frenectomy on a 12-year-old lady. She was the daughter of the nurse of the dental practice. That was a private course I did in Poland. This is without injection, just topical anesthetics, nothing fancy like they have in the US, just lidocaine. And you can go very fast. I will show you a case later on. Or you can go very slow without the need of anesthetics injection and with minimal to zero bleeding. You'll have a close-up view also on the surface in a second. You can see there is no thermal side effect, there is no color change, there is nothing like carbonization or anything similar. This is just cold ablation. With delicate powers like this, you can go and have this. As you can see, there is no injection spots or anything like that. And next day, when we asked how she's feeling, because she was still in the practice, she says, "Why are you asking today? Like, I had the surgery yesterday. It's done and over with." Obviously, if you look in there, it's not healed fully, but she feels it's gone, it's healed, it's past. Then something like this, again, this is without injection. This is 2 times faster than the normal recording, so it's sped up. Again, safe in means of histopathological assessments. And you can do this without injecting anything. So I'll go a little bit further, takes a couple of minutes. Removing that, and then from the palatal side, it's out. Just topical anesthetics, reapplied every few minutes. So, incisions, frenectomy is a surgery without injections, no sutures, and no postoperative problems. Really, really quick healing. That brings in word of mouth and real loyal patients. Now, in cases where you have a little bit more bleeding than you like, this is my case where I did maybe use too much power because I was trying to be fast, which ended up with too much bleeding, which is not an issue, because then we switched to other laser to coagulate the bleeding spots. I'll go a little bit forward to see. You see it's bleeding quite a bit. Then we use the Nd:YAG laser to spot. Let's go a little bit more back. We spot exactly where the bleeding is coming from with a part of a second contact onto the bleeding spot. You stop the bleeding immediately. And then in this case, I was continuing afterwards to finish the frenectomy, but this is to show how easy and quick you can stop the bleeding if needed. Then, so this is a combination of 2 wavelengths. One is to be a bit faster and then stopping the bleeding if there is any need. For patients who might be using anticoagulants, then you switch to your near-infrared laser. There you cannot have any bleeding because it's a very strong coagulator. Now, a coagulation would normally need, obviously, heat, but again, you can see there is no carbonization or thermal side effects. If you use the correct hand movements and the settings, which obviously you could learn in the courses, then there is no side effects. So again, this was a case, a patient who was using anticoagulants, very conscious about having surgery for this vestibuloplasty for better denture stabilization, but we did this all over the mandibula. Again, so these patients you would need to anesthetize, but as you can see, edentulous patients would not be really put off with the idea of injection. So they are more put off with the idea of bleeding and surgery and stitches. So that's the advantage of using the laser for that kind of patient. Uncovering teeth and implants, again, this is without injection. This is the delayed eruption. Obviously, you could actually leave this, but the parents were a bit anxious. Because this is minimally invasive, we did this easily. Just topical anesthetics on the top, just 1 incision to access the incisal edge, and that will be enough for the tooth to erupt normally and the gum to recess to normal position. As you can see in the eyes, there is no twitching, there is no problem, there is no real pain. as we see the incisal edge. Again, with the settings, using soft tissue settings, this is not strong enough to harm the tooth. So you can have this selectivity, like I mentioned, with caries to healthy dentine, you can select between soft tissue to hard tissue. And that's 4 days after. So this is one case where we uncovered a big cavity on the distal of a 7. This was fully under the gum line. So we removed the tissue with the laser. On the same day you can do the restoration because there is no bleeding, no problems. Easily you can restore this tooth on the day. Bone removal, this is a cyst removal, doing the osteotomy to remove the buccal bone to access the cyst. Here you can see again quite fast removal. Again, no change in color. Change in color is a sign of thermal side effects. On the soft tissue, it could be brown or black. Black is too bad. Ideally, you shouldn't even see any browns. And on hard tissue, it could be brown, dark yellow, and you don't see any of that with the settings used. And you can see it takes a few seconds to remove that bone to access the cyst. And then you can use the photoacoustic shock waves to actually clean in that. So that's what we are doing on the endodontic side, as I mentioned. Again, you can see the vibrations and bubbles, which is cleaning within the root canals. And this is a tooth that had earlier on been cleaned with ultrasonic cleaners, ultrasonic activators, and the dentist treating that patient said, this is fully clean, even if we use the laser, the sweeps, we won't see anything coming out. And then I said, let's try, and then we used the laser. And all these bubbles, after the activation, there's a resting time where we see the interaction between hypochlorite and the debris, and we see all that debris coming out. That's because of the agitation with the laser and the photoacoustic shock waves. And he was shocked to see that, because he would bet nothing would come out. So what is it that's important about things coming out? One, so that's the technology I'm talking about. It will repeat again. You see the laser is at the coronal pulp chamber, so it doesn't go into the canals. It creates a bubble and shock waves, which creates secondary bubbles mid-root and at the apical base. And those bubbles, as they re-implode, they create more shock waves, which clean the smear layer on the dentinal wall and pushes the hypochlorite and EDTA into the side canals and the apical deltas, etc. So where does this lead us? I don't do endodontics, so I asked my friend if I could show her cases, which she posts on Facebook with some stories. Lateral canal, apical delta, mid-root lateral canal, unfound second canal. And this one, she couldn't use her instruments to go past half the root, but Sweeps was able to clean the whole root, and when she was filling, it was filled without any instrumentation. So that's how strongly you can have the cleaning done. And she kindly sent me this. If you want to show some of my cases, she showed this slide. Again, you can see the cleaning there, 90-degree curve, mid-root, apical delta, second unfound root, and same apical branching. So all this can be possible to be filled if what's inside is coming out, and that's possible with the Sweeps technology. And these are some SCMs from the dentinal walls, mid-root and apical area. So these are the protocols, and then we take it to periodontology. Same technology with secondary bubbles. We are aiming to get the laser at the crevice of the pockets and having these clean furcation areas and deep pockets. So this is 7 millimeters away, and we still have very strong photoacoustic shock wave and cavitation effects at the base of the pockets. Again, this is to remove the smear layer, the calculus, and all the toxins residing on the root surface. to get the attachment we want. Then we take it to extraction sockets. Again, to stimulate bleeding if you need to, we clean all the granulation tissue within the pocket. And then periodontal defects on flap surgeries. Again, furcation areas and hard to reach areas where the defect is too narrow but very deep. So that's the furcation area actually. You can see some calculus, which is then cleaned away with the sweeps technology. So perio, I mentioned the steps: deepitalization, disinfection, root treatment, which is removing calculus, debris, toxins, very important, specifically removing the toxins, and roughening the subgingival root surface, which increases the cell attachment capacity, like in implant surfaces. And then at the end, we use the laser to stabilize the clot within the pocket, which we can also use for extractions. The laser will create the clot to be very sticky, very dense, very difficult to be removed. So especially for smokers and so forth, this will also eliminate the risk or reduce the risk for dry socket. We use the same thing for perio to stabilize the clot, and then we use the biomodulation. And here you can see calculus being removed easily without creating any dent or any removal of the root surface. Disinfecting, removing smear layer and the toxins all together at the same time. Obviously, it's a bit easier when the patient is in your hands, but still we have the same opportunity within the root pockets. So the real effects on the top left, you can see the disinfection. Here you can see calculus coming out from the root surfaces being detached. And then here we did the clotting. It takes 4 or 5 seconds, so that was a bit shorter. And then we use the biomodulation at the end of the treatment, again to reduce inflammation, to boost healing. So first, third and fourth are the near infrared and the DIAC, and the main one that's removing the calculus and being applied on the root surface is the erbium YAG. So lots of clinical studies about clinical attachment gain, bactericidal effect, inflammation effects, and patient comfort on the use of these lasers for periodontology. So what do we get at the end? Initial situation here, you can see deep pockets, quite wide also, pocket, but also bone defect. The posterior tooth was removed, and this is 3 months later and 6 months later. So obviously, to get these results, you need 3 wall defects, so it won't work with a single wall defect. But when you have the right cases, this is what you can actually expect. Then, again, disinfection, deepitalization, calculus removal, detoxification, and biomodulation for better results. And word of mouth. Again, surgical use, if you raise a flap, you can still use the laser for granulation tissue removal, which is selective to soft tissue, so you won't be removing any bone. And then you can use the same steps for deep disinfection, clotting, and root surface modification. Let's see. One case here where we raise the flap to clean the defects, mesial to upper right 7. Just a little bit bone that same day after surgery coming out from the bone implant bed preparation, so nothing extra like bone graft. This is the healing, this is 2 years later. Just opening up, cleaning, stabilizing a clot with a few bone chips in there. Implantology, we start from extraction, and here are the steps: degranulation, deep disinfection within the bone so that we kill all the periopathogens that could be in the bone, decortication if the bleeding is not enough, if it's not coming out, and then at the end clotting to have a stabilized clot at cleaned and disinfected sockets. And obviously, if you are placing implants, this is again the best socket you can place the implant in because of what we are doing. Then peri-implantitis. Again, as I said, very hot topic. Let's look what we can achieve with the shockwave modality. So this is coming from the head of laser academy in Japan. This is dipped into a water container filled with water. This is the laser few millimeters away from the implant, and then when it starts working, all the calculus and biofilm is pulled away. This is the photoacoustic shockwave I mentioned that we use in endodontics, the bubbles we saw. So this is what it's doing. So it's not a direct laser effect, it's just shaking things up, basically, yeah? Again, we use that in non-surgical peri-implantitis treatment where possible. Just going in, as you saw before, within the pocket, nothing too exciting there. But this is 5 years later. The pocket was 12 millimeter around the implant. Now down to 2 millimeters, no bleeding on probing after 5 years. And that's the before and after CBCT. Quite a big defect there. Not there anymore. Loads of studies and background on the peri-implantitis treatment, on biocompatibility and cleaning and safety. Another case for peri-implantitis, that's the surgical approach. 50% bone loss around the implant, erbium to clean the implant surface and the granulation tissue, NDI for disinfection and biomodulation and clotting. 3 years later, 5 years later, 7 years later. There we go. Very stable, very successful. No pocketing, no inflammation. So with complications, again, we can use the biomodulation in lip cuts, burns, nerve damage, etc. We can use the biomodulation effect to help these patients and many more indications. Let's see. We'll just need 1 second to go through a few things. Just because I have 2 minutes left, let's see what we can do. And I'll get some questions if that's possible in a minute. One thing about biomodulation, that's what I wanted to show you. Where you can use the biomodulation with the help supporting the healing, placing the implants, peri-implantitis, wound healing. That is with anything, wound healing. That includes shoulders, knees, heads and toes. I have a 3-year-old toddler, but that is the case. TMJs, trismus. Let's get rid of this. Bone regeneration whenever you are placing bone grafts, periodontal operations, neurosensory recovery, including trigeminous neuralgia, hematomas to get rid of that, quicker abscesses, orthodontic treatment to reduce pain and increase the speed of tooth movement, pain reduction in anything, crown prep, especially if the pulp is close by, wisdom tooth removal to reduce inflammation, teething troubles with kids and babies, post-extraction. Alveolitis is an inflammation situation, so we can reduce that. Herpes labialis, stomatitis, after ulcers, before and after injections, after endodontic treatments. If you have over-instrumented by mistake, definitely will help. Before after caries treatment, hypersensitive dentine, pulp capping, and acupuncture points can be stimulated also by biomodulation. Sorry for the view, but this is, I think, easier to understand what biomodulation can do. With dentistry, whether you did biomodulation or not clinically, to compare is very difficult or impossible. This is a diabetic foot of a family member of a dentist. So was indicated to be amputate it, and the dentist said, hang on a minute. And he used Nd:YAG laser disinfection and biomodulation. 2 weeks later, 4 weeks later, 6 weeks later. From amputation, he was able to save the foot, and this is the same one from below, just to show you how effective this potential of energy is for regeneration and healing. Crown lengthening, very quickly, you can use gingivectomy and, as I mentioned, the bone removal. Let's see if I can show you this quickly. No. Without raising the flap. Depigmentation, you can remove all pigments, again without injection, just topical anesthetics will be enough, and that's 1 week later, epithelialized fully. Bone removal we discussed. Veneer removal, you saw some examples, this is the same. It takes a couple of seconds if you are not wanting to save the veneers, just maybe under a minute if you want to save the veneer, otherwise it's much quicker. Just last two things that are quite interesting. This is the night lace treatment that we do for snoring. You can see how easy, actually even boring it is. It's just, as I said, stimulating tissue regeneration, increasing collagen production and shrinking the tissues to open up the airway so that we can get this. So this is before and after mode of treatment. Airway minimum area was increased 4 times in millimeters square. This is the airway volume, increasing more than, I think, 16 times. So this is how we can help sleep apnea and snoring, opening up the airways. The last thing is with aesthetics. So we can use 2 modalities, lip lace and smooth lace. One is specific for lips, the other one is for the rest around the mouth. These are applied intraorally, so you don't need to be trained on the skin. There is no side effects or anything around that. And this is what we get, stimulating collagen production, pumping up the lip volume, and smoothing the skin from regenerating from within the mouth, from the mucosal side. So nothing on the skin, but you can add to your training and you can also do skin treatments to have better results. So this is on the lip. And the application is, again, very simple. Takes a few minutes. Stamping laser energy on the lip. You can see this specific handpiece that is providing fractionated laser. So that's not a full beam, small points. And that's the results you can get. This is also with a filler, already with a filler. And then we can improve that with the laser option. And this is where you go all in. So 4 steps where you do intraoral, extraoral, resurfacing with peeling, and rejuvenation with also the Nd:YAG. One last example of facial aesthetics, and the interesting thing is the last one. So this is before, and obviously the older the age, the more difficult to regenerate skin. And here you can see very good results. And normally you need to top this treatment up with the snoring and the skin. This is without any top up. 4 years later, if you compare this to how it was initially, the patient is actually getting older, obviously, but still doing well without any top up. So very long lasting results. But if you do the top ups, they usually stay stable. And that's about it. So here you can see what we did with the lasers, that's possible. So we use the benefits of the near infrared with the deep disinfection, clotting, and biomodulation with healing. And then we use the erbium for ablation and facial aesthetics and snoring with the non-ablative properties. And that's what we call twin night treatments to get the best out of 2 different laser works. Last slide. Is it possible to integrate this into any practice? I think if this train is integrated into this marketplace, a high-end laser can be integrated into any practice. You might want to look at return of investment and cost and what you can do with this and how the return of investment will be. But in my heart, the best thing is how better we can serve our patients, and that's definitely there. It goes back to normal. Do we have time for questions? Yeah? Yes, I think we do, yeah? Few minutes for questions or not? No? We're done, yeah. I'll be around and also at the photo booth. If you have any questions, I'm happy to chat. Thank you.